Good afternoon. So today I'm going to demonstrate how to perform tracheostomy care. So tracheostomy care is a sterile procedure. Okay, so today I'm not going to mention the indications and the principles. So this trolley has been made surgically clean already. Okay, so let me just mention some of the requirements. So I have spirit expiring date 2025. I also have normal saline expiry date 2026. I also have clean gloves expiring date 2025. Okay, so this trolley has been prepared for you already. So this is how they put the trolley when you're doing OSC. Then I also have a suctioning machine. So before you start doing this procedure, you need to check if the suctioning machine is working. Okay, so we have Mrs. Banda here is our patient today. So I already got permission from the in charge and from Mrs. Banda. Okay, so before you start doing everything, before you start doing anything, you need to come to Mrs. Banda. Okay, so when you come to Mrs. Banda with your clean gloves, you need to put Mrs. Banda in a semi-fowler's position. Okay, so Mrs. Banda, allow me to put you in a semi-fowler's position before I start cleaning the tracheostomy tube. Is it okay with you? Okay, so it's okay with you, Mrs. Banda. So I need to put Mrs. Banda in a semi-fowler's position. Okay, so I'll put Mrs. Banda in a semi-fowler's position. Okay, so Mrs. Banda will be like that. Okay, and I'll remove the saline gauze here. Please get closer. So I'll remove this Vaseline gauze here. So I'll leave the one there. So I'll remove my gloves. Now I'll go and prepare my things. Okay, so let me go and wash my hands. Okay, so I've washed my hands. Okay, so from here now I'll get the cheater forceps. Since everything has already been prepared for me, so that's this is our suctioning tube. So in some cases you find that it has not been connected for you, so you need to connect yourself. So this is where another problem comes in. So we need to show us the skill on how we are going to connect this suctioning tube to the suctioning machine. But in other instances you find that it has already been connected for you. Okay, so also get the hand towel. Okay, so this is the hand towel. So from here, so you pour normal saline, as usual, away from the label. Okay. So I already have a syringe containing sterile water or normal saline. And I already have sodium bicarbonate, which is on the tray here, on the suctioning machine. Okay, so the purpose for that sodium bicarbonate there is to prevent the mucus from sticking inside the tube. Okay, so always when you are doing this procedure, you are supposed to have sodium bicarbonate. If your suctioning tube doesn't, if your suctioning machine doesn't have a tray there, you can use a gallipot or a bowl. Okay. Your spirit. Okay, so now let me go and do my sterile hand washing. Okay, so you pick, this is the first corner, you wipe your palm, this is the second corner, this is the third corner, this is the fourth corner. Okay, that one goes there. Focus on the patient. So now I'm donning gloves, sterile gloves. Okay. So as you are doing the procedure, you can be interacting with the patient. So interacting with the patient is very important. Okay. So we've done our gloves, surgical gloves. Okay, so let's prepare our swabs now. Okay, here. So let's prepare our swabs. So we'll prepare the swabs. So we are preparing these swabs using normal saline, not spirit. Okay, so prepare these swabs. Remember, this is a sterile procedure. I'm not supposed to talk, but for learning purposes, allow me to talk. Okay, so now we've prepared our swabs. Okay, so now here that's where the problem is now. Okay, so you need to get big swabs. You dip it into spirit. Okay, so this one sterile. Okay, you can touch it or you can use a swab. You don't have you cannot be penalized. You can use a swab since you are sterile. Okay, or you can touch the tube if you want. But here, this is where the problem comes now. Okay, you cannot touch this tube minusing or using your sterile gloves. So you need to touch the tube using the sterile gloves here. Okay, you are touching this tube using the swabs, not your sterile swabs. So you can connect like this. Okay, so you connect it like that. Okay, so this one so this can go there. Okay, so we have normal saline here. So now we've connected. Okay, so here now that's where you use the dissecting forceps. So focus on the patient. So you get this one and it goes. Okay, so now remember, this is a sterile tube. Okay, suctioning tube. So before you go in, you need to pinch. Okay, so when you pinch, you go in like that. Okay, you can go in like that, then you release. Okay, coming in a circular motion. Okay, so from here now you have to go in your normal saline. Okay, in your normal saline like that. You pinch again. Okay, you pinch again. You come out using a circular motion. Okay, you go in your normal saline like that. You pinch, go in. So this tube can only be in the tracheostomy tube for about 5 seconds. Okay, or less. So from here now, according to your assessment, if there are no mucus coming out, you can put it in the sodium bicarbonate. Okay, so this is where now you use the sodium bicarbonate. Okay, so from here now, if this tracheostomy tube is maybe for 8 hours or 24 hours, you need to encourage the patient to be putting normal saline in the suctioning tube. Okay, after some time, you tell the patient to put some normal saline using the syringe. Okay, so now the other part is you need to clean the outer part. Okay, so this is where now you clean. Okay, this one goes there. So normally here sterility has ended. Okay, this is just clean. This is a wound which healed. So I'm not cleaning the wound unless it's a fresh wound. Okay, so sterility is normally on the cleaning when suctioning. Okay, so you put the Vaseline gauze. So the purpose for this Vaseline gauze is to suctioning or to suck all the excessive mucus that can be seeping out. Okay, so you put it like that. Then you also get a Vaseline gauze. Okay, then you put like that. Okay, so from here now you need to thank Mrs. Banda for allowing you to do this procedure. Okay, then you give them, or you give her appropriate IEC. Okay, so from there now you have to report and document. So basically that's how tracheostomy care procedure is done. It's a very simple procedure and interesting procedure. Okay, so as you are doing this procedure, you need to make sure that you interact with your patient. Okay, otherwise, thank you so much and follow for more.